vaccination came, this gentleman offered me to get myself vaccinated. Typical, you see, like I should not say Indian, but like typical mindset. I thought I'm 43, so I thought ki why I should first get vaccinated. It has just come in the market. Let other people get vaccinated, and based on experience, I will see. But now I'm really missing it. Now I'm in the queue. So that is what this question is. Are the vaccines safe, and what happens after we take vaccine also?
So vaccines are really safe, and no has in the situation and the present situation, the only thing that we can trust and rely only on vaccines. As I said you, the vaccines were tested for its efficacy. Vaccines are really tested for efficacy for the severity of the disease. If you have the vaccine, the severity of the infection rate and not will be very much high, and the hospitalization rate will be very much less. But trust that you are not fully protected, and if you go vaccine, and if you have vaccine and if you go in front of a positive patient, ask him to cough on you, and so it can't possible, so you will be getting infected. So infected is infection is a different thing, and severity is a different thing. Vaccine can protect, will not be protect against the infection, but it will be definitely protect you against the severity and hospitalization admission rate.
Okay, okay. Now, Dr. Saab, we live in the world of guarantees and warranties. No, for everything now we need some sort of guarantee or warranty, whatever we buy. Now, again, the same like no principle here also like applicable. Um, like, can one get COVID after taking
Right.
vaccine? In fact, you gave a very elaborative answer. If you little bit highlight, no, once
Yeah.
more.
Definitely, and anyone can get COVID after taking vaccine, because a lot of my friends in the medical fraternity has got two shots of, I mean, two jabs of vaccine, and they got infected, and they came back. uh, but not severe. But severity is very much less when compared to the person who not got vaccinated, and post complications of COVID also very much less. For the if we compare two persons who got vaccine and not got vaccine, the post COVID complications were very much less for this person who got vaccinated, and when compared to the person who had not got any vaccine dose. So yes, you will get COVID even after you get vaccinated, but not much severe.
Oh, okay, okay. Um, Now, these actually, Dr. Saab, I also want to ask you. There has been like in the beginning, people said some time period. I don't want to comment what exactly. Over a period of time, what I found these when there were like even when now also there are shortages even at that time. So when we started having shortages of vaccine, what I found, say if people say that okay, you take first dose and second dose, whatever, maybe 40 days, 50 days, this time period is increasing. Now, how come basically in the beginning you said, okay, this is the time period under within this time period you have to take it. Now, how come basically because now there is a shortage of vaccine, they have said no, 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 you can wait 2 months, 3 months. So, how true it is? What happens if we miss the second dose, or
Yeah.
what is the time period and all that?
So actually, even we also thought that same thing is done due to the shortage of vaccine, but that research and articles and publications prove that it's not due to the shortage of vaccine, and it's a genuine reason, because during that like we are in very much hurry, we are in very much hurry for launching the vaccine. So we had done only the basic trials for the vaccine, and whether vaccine is safe or efficient or not, but not done any deep trials on the phases of the time period of the vaccine.
Okay.
So now after the administration of vaccine, we got ample number of time for testing that second dose or third dose or which or booster doses. So now it was clearly indicated that there is a 84 days for the Covishield, and 4 to 6 weeks for the Covaxin. So and second question was like, what happened that we missed the second dose, and generally we should not miss the second dose, and it's better to take the second dose in the particular time. And if anyone misses the second dose, then they can avail the second dose out of the time also, but the formation of the antibodies will be somewhat less in the person got missing the second dose. That's the
Yeah, in
thing.
fact, I am basically now coming this. In fact, this is now the supplement to the earlier question. Now you said something 84 days. So now this question is that is what it is like. We suppose we have taken the first dose, and whatever may be the reasons, now this 84 days becomes 100 days or 105 days. Then what happens, Doctor Sahab?
So for Covishield, the protection rate is almost up to 1.5 year. So it's a scientifically proved, and even after a few days or few months, we will hear that we need to have a booster dose after 8 to 9 months.
Oh, okay.
Yeah.
So you want to say that there is nothing called as 84 days and all even okay, that's something very good.
Yeah.
Something very good.
So some will be there that like we'll need to have a booster dose after 6 to 7 months or
Okay,
eight to
okay,
nine months for
okay.
product, because in the vaccine which happens for every vaccine, coming from the polio vaccine to MMR vaccine, measles vaccine, any vaccine you could take, that definitely there used to be have a booster dose.
Okay.
And I think this also will happen for a booster dose. And even you see that even I get a lot of complaints and lot of complaints from the from the patients and beneficiaries who got vaccinated. They won't trust the vaccine. They'll come back again. Sir, I got after the having the vaccine, they go to the pharmacy or they go to the lab and they get this antibody reports. They said that, sir,
Yeah, there is something. Absolutely, there is something called
sir,
as
I got
this.
vaccine recently, and this is my vaccination report, and I got to some lab and I got tested, but it's showing that I had not immune. So, sir, it's like after your second dose of vaccine, you need to wait 14 to 40 days for getting full immunity.
No,
So,
as I said, Dr. Saab, this is a world of warranty and guarantee. So now this is something related to life. People want so that mindset is as such. Immediately, no. So that is what I think. Um, I think you also agree to what I
yeah,
said.
minimum 40 days, 40 days is the time for getting a full immunity. And I ask him to go and test, go and repeat it testing after 40 days. Then you can see that you will have a full immunity and full antibodies for the protection of the virus. For after second dose, you need to go after 40 days for the testing.
In fact, that means if I have to conclude, this is a very important, in fact, question. You want to say that whatever you said, 84 days. So there is nothing like that, and we like can whatever it is, 3 months, 4 months, also like that we can like through whatever reason when nobody wants to do that. So that is also fine, is it? Like we can wait up to whatever 3 4 months for this second dose.
Second dose, it's fine. It's fine to wait for 3 to 4 months for
No,
the
but
second dose.
through maybe for whatever reasons, I
Yeah.
think normally people will immediately take it.
Yeah.
It's a matter of life, no?
During that period, if got infected, then it will be
Yeah, that's
risky.
the another question is that. In fact, this question is there in the chat box also. I think this question was posted. In fact, he's posted in the chat box. Now, this is what it is like. What is the right time, Dr. Saab, to take vaccine post COVID infection if anybody
Okay,
got infected?
sure.
So, can you say is there like if anybody suppose if I got infected, then when I have to take this vaccine, and before that vaccine, I also want to supplement that. Do I have to undergo some test, and after that take vaccine? If you can, like,
Yeah. So recent guidelines means last week they had released the guidelines, Indian guidelines
check.
for regarding this vaccine, post-COVID vaccine. So if a person got COVID, and he need to wait minimum of 6 months for getting his first dose of vaccine. And if a person got COVID after his first dose of vaccine, and minimum he need to wait 3 months for getting his second dose of vaccine.
Oh, okay, okay,
So for
okay.
your case, sir, you need to wait at least for 6 months for getting your first dose of vaccine.
Mm.
And for a person who already had a first dose of vaccine and he got infected with COVID, I need to wait minimum 3 months for getting his second dose of vaccine.
Oh, okay, okay. Dr. Saab, I also want to ask you, like, in case of pregnant woman, can they like take vaccine? If yes, is there like any time, like how can you throw
Yeah,
some
sure.
light on this?
So and recent guidelines says that antenatal women, like antenatal means pregnant women, are eligible for taking the vaccine. And previously, during the initial stage in the month of January or February, during the launch of the vaccine, they said it's a contraindicated for the pregnant women. But now recent guidelines, as I said, that we are hurrying launching the vaccine, so we had not done any proper research and I mean thorough research for this thing. But now we are on that on the research track, and recent amendment says that the pregnant women are also eligible for taking the vaccine. They are eligible for taking the Covishield, and even they are eligible for taking Covaxin. They are eligible for taking the vaccine. There is no particular months or particular time period. They are eligible for the vaccine.
Yeah. Now I think we are now coming very close to this end of the questionnaire. After that, as I said, we will also try to take some questions from the chat box. Now, Doctor, Saab, one more question I want to ask you that like after taking vaccine, even I have been hearing. In fact, I heard also. What are like side effects and like if I put it in that way, like how to distinguish body reaction post taking a vaccine shot with COVID-19 symptoms? Like some people are experiencing fever and and so on. So like if you can throw some light on that.
Yeah, so many complaints were there, and we are hearing from many people that we got vaccinated, and we having symptoms of fever and dizziness or headache, and these are the common things of that vaccination thing. So I agree, I agree for that thing. There are not a side effects. So because vaccine is nothing but you are injecting some X in your body, some X material in your body. So your defense system is getting activated for killing that X material. So it's a good sign to have this kind of symptoms of like fever or
Absolutely.
headache or this kind of so. And recently I want to share my experience, and recently we got a vaccination drive at our zoo park, like Indira Gandhi Zoological Park.
Okay.
So I had requested them that not all of the staff get vaccinated. So 25% staff need to get vaccinated, and remaining on 25 basis. But they had got 100% vaccinated.
Oh.
So next day, 75% of their staff were not feeling well.
Oh,
All people got on sick leave, and all people got on leave, and the that animals were left away. So
oh,
and again they got new curators from other zoo for taking care of those animals.
oh.
So there were very side effects were be there for the. It's not actually, it's not, they won't call as a side effects. It's the reactions of your body to the new material what have been gone to your
In fact,
infected your body.
we used to tell our this children and all this new like whatever injections and all between 1 to 5 years, whatever they take, we always used to tell them some fever,
You-
something you will get. But when it comes now, we never thought that now it would be coming
Yeah.
to us. So we are actually forgetting. Now we are now this another important question, Dr. Saab, like how to address this fear, Dr. Saab, that in fact I don't want to name a particular doctor, it is not correct, but this I think people will should actually also know this is an important thing. He has been basically actively, I think, in your doctor fraternity also on the social media. Unfortunately, I think last week he passed away and he took both the doses. But when I saw, like, people have been following him like anything, and it's really very shocking when I started hearing in these social platforms. They said, "Arey, this doctor to used to come talk big about vaccine, and what happened? He succumbed." No, like so. This was really painful. And so, what is your advice? Basically, see, this is something we need to address it. Like how to address this particular fear, because this fear is there. Whatever you say, and because see, one more Dr. Sab reason what I like could get a sense. I have seen any vaccine which is related to respiration and all, like something never ever been basically like it has been many years now this vaccine, and again it has not been again tested with the time, like these type of general fears. How come basically you have vaccine? Again, time will only tell how effective or like whether it is not effective. That is why this all leading to fear among the people. So, what do you basically advise? Bottom line, the moment you say, like, even I'm talking about this fear, who all are well educated. They are, you take it from me, many people are still avoiding this vaccine. They are telling, no, I already develop antibodies and all those things. So, how? like how you will address this fear?
Yeah, so even we had experienced this kind of situations previously when the vaccine rollout program is there on the Jan 16th. In the month of February and March, there were very less people used to come to our vaccinated centers. We used to call them, please get yourself vaccinated, but that time the very less people were turn out, and gradually the social media platforms and news channels and media has propagated in such a way that the vaccine were very important to be taken. So the people were turning out. I think maximum the people who were reluctant to take the vaccine in the previous days, or now they're walking to our vaccinated centers and they are getting vaccinated, is a good sign. But as per my knowledge, is something is better than nothing.
Yeah, yeah,
So
absolutely, absolutely.
nothing they, because there is a no treatment and no proper guidelines for the treatment of protocol. Only one thing was like vaccine, at least somewhat some protection is there for us. So and people need to be realize the fact that that something is better than nothing, and they need to leave their fears and get
Yeah, even I
vaccinations.
think you have hit on the top of the nail because I don't know, but if you see, like when we started this year, 2021, January, February, March, day in and day out, there were reports from, especially I'm talking about United States of America, high mortality rate. But again, what we could see that now also there are 65,000 cases they are reporting, but that type of mortality rate is not there because they, I think, have started vaccination on a large scale. This is what like we have been hearing, even a couple of my friends who are telling. So like previously that hue and cry what was there, now that is very much subsided. So as you rightly said, then this is the last question. After that, we will quickly take some questions from the chat box. Now, Dr. Saab, that what this prevention and protection measures one should follow even after taking the vaccine, because this is again like live examples I have seen. People have taken vaccine. Any like what you should call it, post vaccine precautions they need to take it, or how it is,
Yeah.
because the moment again they get or infected through COVID, then all get disturbed. Forget that individual getting disturbed, I will accept. He will spread this to other people. So I'm worried about that.
So nothing there. The even he got vaccinated or not, the he should follow the same principles and protocols. That he should wear mask and he should follow the basic COVID appropriate behaviors. Nothing else. But only one thing was, after the vaccinated, they'll ask whether we should eat, or whether we should, what should we eat, what should we drink, and what should we not to do. And same thing, a routine thing. Only thing was like, even after getting a vaccinated, you should wear your mask and you should follow the proper COVID appropriate behaviors. Nothing more than that.
Okay, fine.